Now, the Trump administration's decision to cut 90% of USAID's foreign aid contracts has sent shockwaves through humanitarian projects worldwide, including South Africa's HIV/AIDS programs. Now, joining us is Dr. Mvuyisi Mzukwa, chair of the South African Medical Association, to discuss the potential impact of these cuts. Dr. Mzukwa, always good to speak to you. Now, can you explain the potential impact of these funding cuts on South Africa's HIV/AIDS programs?
Good afternoon to you, Hugo, your crew and your viewers at home. As you can imagine, Hugo, SAMA is among the healthcare groups or organizations that are devastated over the decision by the United States to cancel US aid-funded health programs globally, like you said, including South Africa. Now, this is, as you can imagine, we take it as a clarion call to government, our government, to limit its dependency on foreign aid. But this impact, it has got severe repercussions on one, HIV/AIDS and TB control efforts, in the country. And it will, one, restrict access to ARTs or antiretrovirals, especially to the vulnerable populations. But also it has a significant impact, Hugo, because it will disrupt our research when it comes to, HIV and AIDS and other infectious diseases, where, as you know, South Africa especially has been a leading global hub in this regard. So it has far-reaching implications when it comes to these programs that I've identified now.
Dr. Mzukwa, South Africans that are on HIV treatment of some sort run into a number of millions. Right now, this is a huge number. What happens now to these individuals? Are you feeling the impact immediately?
Yes, I must say that if we are not doing anything about it, it has got ripple effects, to increase HIV-related complications, like I said. Also, but people may die if time goes without treatment. But also, you can imagine it could escalate treatment costs and maybe lead to different strains, in terms of HIV and or resistance to HIV and TB. But what we need to do in this case, we do need to urge our government to prioritize containment of HIV/AIDS and TB. As a national emergency, we can't be beating around the bush on this issue, and also allocating emergency funding to sustain essential healthcare services all across the country, especially the vulnerable communities. But we urge government also to secure alternative funding, mechanism. You remember I said we can't be depending on foreign aid forever. It has been about 21 years since this program was started. So we need to stand on our own as the country. We can't be depending on this, begging other nations to assist our cause. But we must also establish a massive task force so that we safeguard and sustain the progress made, as you know, on HIV and AIDS and TB programs in the South African context. And we are worried about those healthcare workers who have lost their jobs. So we are urging government to consider redeploying these skilled healthcare professionals, to have who may have lost their jobs, to really assist in the public health sector with their expertise, so that we control or we curb, the progress of these conditions.
Dr. Mzukwa, we have information that as little as 17% is what PEPFAR was contributing to the budget for HIV and AIDS in South Africa. Is this figure correct, or do you have that number or that percentage of what that contribution actually is?
Yes, you are correct, Hugo. It is about 17%, and it was sitting at around 7 billion rands. And we think that, looking at our context, That is particularly significant, knowing that we have got ongoing budgetary constraints. You know, as you may recall, our recent pronouncements on this issue.
Now, it raises the issue, Dr. Mzukwa, because a week ago, you and I had a conversation about the 1,800 junior doctors that aren't employed because the Department of Health has said that they do not have this resource. Do we expect government to find the resource to make up for that 17% that's going to be lost?
We have no option, Hugo. We really have no option, because if we do not attend to these abandoned patients, especially programs, especially in the vulnerable areas, it will, one, escalate the challenge that we have in terms of HIV numbers, but also, you know, we'll have a problem of spreading of the HIV disease in the country, and the resistance that we're talking about, and that could cost the country more. So we do not have any option. We have to find money elsewhere. I mean, like I always tell you, that in South Africa we have money, it's just that it's being mismanaged. So we'll have to get money so that people don't die from this disease.
So final thoughts. How does government deal with this situation immediately? Right, so we've talked about 17%, so it's about 1/5 of the current budget, which obviously is not consumed immediately. You know, what is your advice on how they manage it in the immediate term as they look to stopgap measures in the short term or long term?
Hugo, they must obviously get and allocate emergency funding to this. They need to get emergency funding so that, you know, they sustain these essential healthcare services in the country that have been affected, especially in the most vulnerable areas. We know that there are 27 districts in South Africa that have been dependent on this. And we also know that in some provinces like KwaZulu-Natal, there's been about 7 districts or so. So there has to be an emergency funding that is really allocated. We can't disrupt treatment or management of HIV and TB in this country. It would be disastrous, not only for those who are living with the condition, but also us, you know, because you can imagine in the trains and in the buses where people are coughing and stuff like that and having TB, and they spread that to others. You can imagine the impact on the healthcare facilities, what that could be. So we have no option. We must get emergency funding.
Dr. Mzukwa, always good to speak to you. Dr. Mvuyisi Mzukwa, Chair of the South African Medical Association, and speaking to us about the need for emergency funding to support HIV and AIDS programs in South Africa. And this is following the cutting of PEPFAR funding by the US administration.